I would like to welcome everyone to our webinar on transforming food systems. I'm Rahel Gazal, Senior Learning Advisor on the Grocery Nutrition Project. I'm with Tufts University and I'll be moderating this webinar. As many of you might know, United Nations is convening a Food Systems Summit in September 2021. This summit is expected to bring together heads of state, country delegates, policy officials, and a range of other stakeholders to discuss innovative strategies and solutions to effectively transform food systems to achieve many of the sustainable development goals. In this context, Feed the Future Grocery Nutrition Project hosts today's webinar. On the webinar, our first speaker, Eileen Kennedy, a professor at Tufts University, Friedman School of Nutrition Science and Policy, will highlight core elements of the system, external drivers, and political economy issues that facilitate or impede change in food system. Critical gaps in our knowledge regarding trade-offs targeted in SDGs will also be discussed. There will also be extensive discussion on policies that can bring about dramatic change in food system. Following Eileen's 20 minutes presentation, we have two commenters, Dr. Talavalle, Associate Professor at the Center for Food Science and Nutrition at Addis Ababa University, and Dr. Namo, Senior Research Coordinator at FB Ethiopia. Each will have 10 minutes to reflect on the topic with the focus on local context. Finally, we'll have a 20 minutes question and answer session. Before we get started, I would like to share a few ground rules. Speakers, please turn off your microphone and camera unless it's time for you to speak. Participants, we encourage you to forward your questions using the Q&A box by including the name of the speaker you would like to respond to your questions. We would also like to acknowledge that we have received many questions from participants during the time of registration. Now, the webinar is being recorded and all webinar materials, including the link to the recorded audios, PowerPoint presentation, summary report, and supplemental reading materials will be shared with all the registered participants in the coming days. The internet connection seems to be working fine on my side so far, but if I happen to have any issues, Eileen or one of my colleagues will take over the moderating role. Now I would like to introduce our first speaker, Professor Eileen Kennedy. She is a former Dean of Tufts University, Friedman School of Nutrition Science and Policy. Currently a professor at the school, Dr. Kennedy's research interests include assessing the health, nutrition, diet, and food security impacts of policies and programs, nutrient density, diet diversity, and agricultural nutrition links. She is a member of the high-level panel of experts on food security and nutrition of the UN Committee on World Food Security. And she's also a former member of the UN Standing Committee on Nutrition Advisory Group on Nutrition. She founded and was the first executive director of USDA Center for Nutrition Policy and Promotion. She created the Health Index, which is used as a single summary measure of diet quality. She is currently a member of the World Economic Forum Global Council on Food Security and Nutrition. We're very glad to have Eileen Kennedy as one of our speakers for today's webinar. Participants, please forward your question to Eileen while she makes her presentations. Now I'll turn it over to Eileen. Thank you.
I'd first like to thank the United States Agency for International Development and Save the Children for supporting this work. The title of this presentation, Transforming Food Systems, the Missing Pieces Needed to Make Them Work, derives from a paper which is in press that will come out in Current Developments in Nutrition. If I could have the first slide, please. Over the past 5 years, I'm chuckling a little bit, it's been hard to turn around and not see a significant high-level report on food systems We have the foresight report. We have the high-level panel report on nutrition and food systems. And as we see in the next slide, part of the motivating force for these publications is the United Nations Decade of Action on Nutrition, which spans the time period 2016 to 2025. The aim of the decade really is focused on achieving global nutrition targets, including diet-related non-communicable diseases, as well as making progress to achieving the Sustainable Development Goals. What I think is very important in this slide is number one, of the 6 actions to address the decade of action on nutrition, the first one listed is sustainable food systems for healthy diets. And in the next slide, 2 of the key sustainable development goals are Sustainable Development Goal 2, zero hunger. Embedded in that is ending hunger, achieve food security, and improve nutrition, and promote sustainable agriculture. There's a lot in that. And in the next slide, Sustainable Development Goal 12, ensure sustainable consumption and production patterns. And indeed, there are other SDGs which relate to food systems, but these are the 2 on which most attention has been focused from a food systems point of view. Next slide, please. The initial driving force for food systems was the increased epidemic of overweight and obesity, really put increased emphasis on how we use food systems transformation to deal with overweight and obesity. Next. In addition to the Decade of Action on Nutrition, the United Nations, building on that, will hold a UN Food Systems Summit September 2020 in New York City. And a big question that is being posed is, what are the bold, new, innovative actions that can use a food systems approach to achieve the SDGs? Next slide, please. The focus of this summit will be threefold. One, and I want to underscore, country level. Identify significant solutions to achieve the SDGs with an emphasis on country level actions. They want to establish principles to leverage food systems across the entire food chain. And thirdly, effective use of partnerships. And really underpinning this is no one institution, no one individual can do this alone. Next slide, please. Partnerships. I just use this as illustrative. This is a partnership that has been ongoing for about the past 5 or 6 months. It includes public, private sector groups and parts of the UN, like the International Fund for Agricultural Development, international NGOs like the Global Alliance for Improved Nutrition, and as you see midway down here, Tufts University, Friedman School of Nutrition Science and Policy is part of this partnership, which is trying to provide backstopping and impetus for the Food Systems Summit. Next slide, please. Food systems. I'm not going to read all this, but a food system, all the elements and activities that relate to production, processing, distribution, preparation, and consumption of food, with an aim to improving nutrition, improving diets, improving health status, and the last phrase there, and environmental sustainability. So it has a nutrition objective as well as an environmental sustainability for the food systems. Next slide, please. Now, this graphic comes out of the high-level panel, Nutrition and Food Systems. Some people refer to this as from farm to fork or farm to table. And what we see at one end of the continuum is the agricultural part of the food system, food supply, production, storage, distribution, processing, retail. At the other end, aspects related to the consumer, consumer behavior affecting diets. And what I want to emphasize here is in the middle, the food environment. It's the food environment which links the agricultural part of the food system, food supply chains, to the consumer. We want to explore much more about food environments. Next slide, please. Again, I won't read all of this, but let's look at the second bullet. The food environment includes the foods available to people. Can be public or private settings like shops, markets, street stalls, restaurants, schools, workplaces. And where relevant, food grown by households or exchanged in local communities. And what's very clear is the food environment can vary in different countries, and even within a country, food environments faced by households are very different, usually in rural versus urban settings. Next slide, please. Now, this is a very busy slide from my colleague Karina Hawks, and looks at how food environments are shaped by food systems. Very busy slide, and you have to think, well, where to begin? And I'd like to unpack this a little bit. If I might have the next slide, please. What is a healthy food system? And I sort of chuckle a little bit at this because I don't think of a food system as being healthy. I think healthy is a term that applies to humans or animals. But anyway, what is a healthy food system? Next slide, please. And in today's parlance, a healthy food system really is equated with a sustainable food system. And a sustainable food system is a system that ensures food security and nutrition for all in a way that economic, social, and environmental, I'm going to underscore environmental basis, are attended to generate food security and nutrition for current, but as well as future generations. So future generations are not compromised by actions we take today. Next slide, please. The IFPRI Global Nutrition Report in 2015 talked about 5 different typologies of food systems. At the lower end, we see here the rural or traditional food system, which we still find very prevalent in rural areas, smallholder agriculture. And then there's a transition from the rural through various transitioning mixed food systems up to the industrialized modern food system, which we find in a lot of industrialized countries like the United States and Western Europe. However, I'd like to emphasize that even within a given country, we find a mix of food systems. So there's not one food system necessarily. Next slide, please. Sustainable diets derive from sustainable food systems. Again, diets with low environmental impact, which ensure food and nutrition security. And again, last line, while optimizing natural and human resources. Next slide, please. This framework again. So here we have a framework, and we see this over and over again in different formats, but illustrating the same thing, going from farm gate agricultural production all the way up to the consumer. And I think now what the discussion is, particularly around the UN Food Summit, is okay, we understand the concepts. We've had a lot of discussion about the theory. What is it we do? What are we actually asking countries to do, since we emphasize country level activities? What are we asking countries to do to have this dramatic transformation of food systems? Next slide. And I'd like to talk a little bit about Ethiopia. If you look at a lot of the literature on Ethiopia, the term Ethiopia as a success story comes out over and over again. And I'm going to talk about why. I'm going to talk about why from a nutrition point of view and why from an agricultural point of view. Next slide, please. Here we look at trends in nutritional status of children under 5. A 2020 article in Lancet by Zulfi Buddha and his colleagues describes Ethiopia as a top performing country, and I think deservedly so. What we see here in the blue line is since 2000, a steady decline in the rates of stunting. And we also see since 2000, a steady decline in underweight. Next slide. Ethiopia is also seen as a success story in agriculture. And if we look here at the time period 2011 to 2015, a steady increase in the production of millions of quintals as a percent of national. And this increase from 2011 to 2015 is about a 56% increase in production. So this is significant. Next slide. But again, what are we asking countries to do? And let me talk a little bit about Ethiopia. When I was involved in growth through nutrition, and before that engine, in some of the policy related work, as I got to know some of the senior policy officials, I would get comments in a very forthright way. Agriculture has been successful in Ethiopia. and I think the data confirm that. Ethiopia agriculture has been successful. So what are we being asked to do differently, and how are we being asked to do it? If I could have the next slide, please. Now, this is a paper graphic by Patrick Webb, a colleague of mine, and others from Nature Food, where they outline national actions, policy actions, and they divide this into 4 quadrants: availability, accessibility, affordability, and desirability. Let me take just one of these in the availability quadrant. Last bullet: promote production of a wide range of nutrient-rich foods. We see this objective in many agricultural plans, in many national nutrition strategies. Next slide. Now, we've already said agriculture in Ethiopia has been successful, but let's look here at food group production. And what we see here, again, 2011 to 2015, grains, roots, and tubers dominate the agricultural production in Ethiopia. If you look at the last column here, the compound agricultural growth rate, it dominates at almost 12% growth, dominates the agricultural production in just this one category. Next slide looks at this a little bit differently. Shannon Diversity Index, the diversity in production. And again, what we see here is, yes, there's diversity, but the diversity in production has been declining from a little over 1 in 2011 to under 1 in 2015. And in most of the regions of Ethiopia, there has been a negative growth rate in diversity. And we'll look at this in the next slide somewhat differently. Same presentation, but graphically. I think what jumps out at me is the blue shade in this circle, where from 2011 to 2015, between 83 and 86% of the energy supply and production comes from, again, grains, roots, and tubers, and it swamps any of the other food groups. Next slide, please. Some work supported through growth and nutrition, some research reinforces what we're seeing at the national level. A project we have under Save the Children: What Affects Production, Consumption, and Sales of Commodities. Our regional level data mirror national data, and you can see here household and key interview data. 3 top line findings: the cultivation of staple crops for consumption at household level to ensure food security and production of cash crops drives household decisions in choosing their agricultural strategy. Households prefer to keep maize and sorghum for family consumption. And this last point: the reality is dietary diversity historically is not a top priority for households. Next slide. So let's go back to these actions. Are there synergies in trying to accomplish this goal of production of nutrient-rich foods? Are there synergies with other actions? And I'd like to look at the quadrant on desirability, where we talk about upgrading food-based dietary guidelines and enhanced knowledge about implications of dietary choices. For me, when we talk about food-based dietary guidelines, I say, of course, because most countries have them. But what is that suggesting we do around food-based dietary guidelines? And are there synergies between this, food-based guidelines, and promotion of nutrient-rich foods? Next slide, please. And again, this comes out of a study on decision-making related to production, consumption, and sales. And one of the quotes, which mirrors many, many more quotes at the household level: vegetables help children develop healthy brains. They become strong and healthy when they consume different kinds of vegetables. Vegetables and animal products are good for pregnant women as well as make the fetus healthy. So we're beginning to see a sea change of how vegetables are perceived. And I should emphasize that this behavioral change component is part of a larger package of improved inputs, improved seeds, small livestock, but this is one component. And again, a finding is it takes time to change behavior. And from this study, where we have influential community leaders involved, it is important in bringing about this behavior change. Next slide. What we don't know so much about is trade-offs, and I want to emphasize this. In a lot of the goals and the policy thrusts, there are possible conflicts, and I just use a few examples. conflict potentially between the sustainability goals and consumption of animal source foods. We know animal source foods, the negative is leave a very high carbon footprint, but we also know animal source foods are key for improving growth, particularly linear growth in preschool age children. So how does a country come out between the balance between sustainability goals and animal source foods? There also can be a trade-off between productivity growth versus sustainable food production. And then finally, I mean, we present sometimes SDG 2, zero hunger, as the prime goal of a country, but there are others. SDG 1, no poverty. And again, we need to think about how policy plays out across the range of sustainable development goals. Next slide. This paper, soon to come out, synthesizes themes from the reports as well as some of the discussion globally around food systems. And it really nests into 5 different areas: reinvent agriculture. And by that, what we're saying in the paper is, how do we address the needs of a growing population, increase productivity, maybe on the same amount of land, done in a sustainable way, transform the food environment, particularly taking into consideration consumer food preferences. How do we change those for the better? Obviously, mitigate climate change, which is essential in sub-Saharan Africa. Engage the private sector. And I think here, the private sector has so much to contribute in thinking about changing the food environment for the better. And we want to influence policy priorities, evidence, evidence, evidence. And I've been in so many discussions where, because of everything that's going on, there's key receptivity to thinking about, yes, we want to change the food environment. Where is the evidence? Last slide. Conclusions. We know food systems globally are rapidly changing. A business as usual scenario will not achieve SDGs. Food systems are changing. Business as usual will not do it. And what we're looking for is dramatic changes in the food system. And with evidence, the time to act is now. Thank you.
Thank you, Eileen, for the great presentation. Now I'm going to introduce our next speaker, Dr. Talavalle, who is the Associate Professor of Human Nutrition at the Center of Food Science and Nutrition at Addis Ababa University. He earned a PhD in Nutrition and Health from University of Montpellier, France, and Masters in Food Science and Nutrition from Addis Ababa University. His research interest is on maternal and child nutrition, micronutrients, dietary intake assessment, and interventions to improve diet quality. Dr. Baye is deputy editor of the Journal of Public Health Nutrition, published by the Cambridge University Press. He's serving as deputy secretary of the African region for the World Public Health Nutrition Association. He is a fellow of the African Science Leadership Program, and he's also honorary research fellow at Biodiversity International. He's a member of several nutrition societies, including the American Society of Nutrition. We're very glad to have Dr. Alab with us as one of our speakers. Participants, please forward your questions to Dr. Alab. Now I'm going to turn it over to Alab.
Thank you, Rahel. Thank you, Eileen, for the excellent presentation. My role here is to serve as a commentator, but I thought that I could be supported with some slides showing figures that are context specific, providing a better view on local diets and some data on local food systems in Ethiopia. So the title is basically Diets, Levels, Trends, and Drivers. Next slide, please. So I would like to show you with this slide the minimum dietary diversity score, how many in Ethiopia achieve that using DHS. So looking 2011 and comparing it to 2016. And you've got it disaggregated by wealth quintile. First point here is that diet diversity is very low. It's about 4.4. It was 4.4 in 2011. Moved a little bit up in 2016 is 12.5. That is considering the 8 food group, the recently updated 8 food group categorization. But what's important is also what's important to notice here is that there is a spread between 2011 and 2016. If you look at the EQ plots, it's showing you that there is a spread, and much of the progress has happened for the highest wealth quintile, indicating that income is one important factor to consider. Next slide. I would like to also again show you what we have for as women's dietary diversity. We don't have nationally representative data, but what you have on the right is from 2 rounds of survey conducted by IFPRI among PSNP mothers who consume, and so major finding is that, okay, the dietary diversity, the proportion of women who meet the minimum dietary diversity is between 1 and 4%. So it's pretty low again. Less than 5% of the women meet the minimum dietary diversity for women, which is 5 out of 10. In the next slide, I would like to show you also what's happening specifically at fruit and vegetable consumption. This comes from the WHO STEPS survey that was conducted in 2015. So in the y-axis, you've got the proportion meeting WHO recommendations. So you can see that very few do meet the proportion of fruits and vegetables that are recommended by WHO. At the national level, only 2.4% meet the recommendations for fruits and vegetable consumption. Again, in terms of diet quality, on the next slide, I would like to show you that this is salt consumption, and what it's showing us, the dashed line is the WHO recommendation, and anything above that is very high. And you can see across all regions, as well as the national average, is above the WHO recommended maximum limit for salt intake. Next slide, please. So you can see that from both ends, if you're looking at it from under nutrition perspective, as well as from overweight, obesity, and non-communicable disease perspective, the diet needs to be improved. And I would like to, so with this conceptual framework, you've got diet at the center, and immediately it is influenced by consumer behavior. So on the next slide, I would give you some highlight about the consumer side of diet quality. So consumer behavior-wise, I think 2 components that are important in the Ethiopian context. One is nutrition literacy, and second is cultural and religious barriers. And both could be shaped by appropriate behavior and change communication through the health extension program, the ag extension, the religious leaders, mass media, etc. But on the next slide, I would like to show you the proportion of people who have access to essential healthcare, and this could proxy and give us a proxy and an indicator about the proportion of the people who have and who can get nutrition messaging through the health system. What you see is the bars are showing you the proportion, and it's disaggregated by wealth quintile. So you can see that there is inequality in terms of access to healthcare. Only 31%, 32% in the poorest segment of the population have access to essential healthcare, and whereas 65% or so have access to healthcare for the richest segment of the population. Similarly, between rural and urban, you've got quite a huge disparity. 41% have access to essential healthcare in the rural areas, compared to 71% among urban centers. So if you're thinking the traditional way of behavioral change communication that goes through the health system, then you would need to increase the reach of access to healthcare to the poorest and to the most remote areas in Ethiopia. On the next slide, I would want to show you again another challenge. So what you have here, the pie chart is showing the health extension workers' time allocation per package. And they have a lot on their table. And if you look at nutrition, it only gets 5.5% of their time. So they have a number of modules that they need to address, not very much limited time. And on top of that, access to healthcare is disparate between rural, urban, and poorest and the healthiest with quintile. So this is telling you that we might need to rethink the health extension program in a way that nutrition can have more time. But yeah, this is if you're considering to provide quality nutrition education, and then you would need to do something in terms of time allocation of the health extension workers. On the next slide, I would want now to move from consumer behavior to food environment components. And one of the most important driver, or one of the most important determinants, is affordability of nutrient-dense foods. Here on the bar graph is showing you the share of income needed to meet the recommended intake of fruits and vegetables by income quintile. And you can see that on average, you would require 11% of your income to meet your fruit and vegetable the fruit and vegetable recommendations. And if you're in the poorest segment of the population, this can go as high as 27% of your income. So a third of your income would be eaten by fruits and vegetables if you want to adhere to the recommendations. So okay, it's good to promote consumption of diversified food, but if you're not doing anything in terms of making these foods affordable, it is a huge barrier. On the next slide, I would want to show you what has happened on the prices. This has been this is a study that was done by IFPRI, looking at different food groups and how they moved in the last decade vis-a-vis the general inflation. So the vertical line is that's the rate of the general inflation. So if it's on the right side, it means that the price increases were above the general inflation. On the left side, it means that there was possibly a price reduction. And so this is showing you that grain, roots, and tubers, in line with what was presented, we've got the productivity increases in cereals, and so in terms of prices, we see a reduction in prices. Whereas legumes, nuts, and some of the nutrient-dense foods that you can see are on the right side of the graph, and that is telling you that it has become very expensive to consume to consume these foods. An alarming point here is also for oils and fats and sugar and honey. The prices have gone down, and this can give an idea of the potential, the implication on diet quality and vis-a-vis chronic diseases, obesity, and overweight. On the next slide, I would want to show you now, this has been touched already. This is the production diversity in Ethiopia at the national level across the different years from 2011 to 2015. We've seen a sharp decline in the diversity of what is being produced, that is considering the food groups that are relevant for nutrition. And this kind of explained the price increases that we've seen on the earlier slides and the difficulty in making nutrient-dense foods affordable. On the next slide, I would like to pinpoint at, and as Eileen said, we've got SDG 2, but also other SDGs, and often the decision is a compromise between different goals, but there could be win-win solutions. This is referencing to a study that was done by Benfica and Turlo in 2017. They used an economy-wide model to identify value chains whose expansion would be the most effective in generating income, reducing national and rural poverty, creating jobs, and diversifying diets. And what has come up is it would be important to expand investments in the fruits and vegetables value chain if we want to address the above the above points. So this is important, not just for nutrition, but also from income perspective, from so many, and touched upon many different sectors, and could be a low-hanging fruit for fruits. Next slide, please. So as a summary, for the consumer behavior, we know that it can be shaped by nutrition education, but we see a significant gap in reach and quality of nutrition messaging. And looking at the time allocation and also some indicators of burnout that were captured in a number of surveys, we see high burnout among health workers. In the food environment, we see that nutrient-dense foods are unaffordable as reflected by price trends. We also think that food legislations are not stringent or are loosely implemented. I haven't had enough time to discuss on this, but I can come on it if you have any questions. And then for the food supply, food production has substantially increased, but remained cereal-based. And so we see significant gaps in the supply of nutrient-dense foods, such as fruits and vegetables. On the next slide to finish, thank you. You can read more if you want on this. Most of the slides came from the report that myself and Kali Hebonen wrote. And thank you.
Thank you very much, Dr. Alab. Now I'm going to introduce the next commenter, Dr. Namo Hovik. And Dr. Namo is a senior research coordinator based in Addis Ababa, Ethiopia. She leads the Agriculture for Nutritional Health to promote evidence-based policy planning and implementation in nutrition, including the promotion of best practices, mutual learning, and policy review and dialogue processes. Dr. Namokolo has a BSc in agriculture and MSc and PhD in nutrition. Before joining AFPRI, she was a senior lecturer at Northwest University in South Africa and led the Food and Nutrition Security Research Program there. Dr. Namokolo has led a nutrition capacity strengthening activities in Zambia and Rwanda, and she is the current General Secretary of the World Public Health Nutrition Association and a council member of the Federation of African Nutrition Societies. Her research has focused on community-based micronutrient interventions related to cognitive function in children, infant, and young child feeding, and broader food and nutrition security aspects on sustainable diets. We're very glad to have Dr. Namokolo with us. She will discuss what some of the two presentations mean for food system transformation in Ethiopia. She will also cover the prevailing policy environment and the implication for food system transformation in Ethiopia. I will turn it over to Dr. Namokolo. Participants, please forward your questions using the Q&A box. Thank you.
Thank you very much, Rahel, for those kind, welcoming remarks. Just to say that I used to be the General Secretary of the World Public Health Nutrition Association, but that was some time back. So yeah, that needs to be updated at some point. So I'm going to respond to what the others have talked about, looking at food systems transformation within the current prevailing environment in Ethiopia. And the first thing I want to say is the fact that food systems will transform regardless of whether we do anything or not, from a policy perspective, just by virtue of the fact that people's livelihoods are changing, the economic realities are changing, what people grow and do change, there's going to be transformation that is going to take place. But I think the idea of food systems transformation that we are talking about here today is one where we try and steer the food system transformation in a positive direction. We know that the industrialized food system transformation that Prof. Eileen showed us earlier isn't necessarily the best in terms of serving nutrition and health outcomes. But we also know that in Ethiopia, the food processing industry as it stands now is really in its infancy. So then the issue is can we transform that our food system in a more positive direction, learning lessons from others where things haven't necessarily worked in the best interest of nutrition and health. And so taking the country-led perspective of the SDGs, the implication is that we need to leverage a country's policy environment and the prevailing food systems there. And for Ethiopia, we really do see a very rich policy environment with respect to food system. And so we have things like the agricultural growth program. We do have the agricultural transformation plan. We have the nutrition sensitive agriculture. We have the food and nutrition policy and now strategy. Each one of these have elements of trying to address the food system, but trying to address the food system positively to work better for nutrition and health for the Ethiopian population. We were told earlier that the agriculture sector needs to diversify to provide a more nutrient-dense food basket. But we have also been told that those foods that we need to increase consumption of are also the ones whose prices have been increasing more in real terms. So essentially what we want people to eat more of are things that are becoming less and less affordable. So the transformation that we want to then promote should be one that makes it possible for people to access those more nutrient-dense foods. One of the areas that is a challenge here is the issue in terms of increasing consumption of fruits and vegetables, is that the fruit and vegetable value chain from a production perspective is actually challenged by not having having a limited seed sector. So access to seed is actually a problem. Even if you talk to people, development partners that are trying to help in this area, you'll find that food seed production is actually a challenge. And so that's an area where transformation is required. Again, the issue of recently now with the COVID-19 pandemic, again, zeroing on seed production. If you think in terms of crops like teff, where the farmers can actually use the previous crop and collect seed from there. For some crops that we have moved towards, like maize, this is not the case, and we are promoting hybrid seed. And with hybrid seed in the circumstances, for example, that we have just had with COVID, you can't just collect the maize from last season and plant it. So you need a fresh batch of seeds each growing season. And so when value chains are disrupted, when markets are disrupted, then you end up with a situation where the farmers actually don't have seed to put for the next crop. And at the same time, a pandemic would have affected people's incomes and make it difficult for them to access purchased seeds, even if it was required. The implication is that as we transform and look to ensuring resilience, these are some of the areas that need to be addressed to look at if another pandemic were to arrive at us, how do we do things differently to make sure that we have less disruptions for the next growing season? Prof. Lynn spoke about food-based dietary guidelines as useful tools to promoting healthy consumption patterns. Ethiopia is currently developing food-based dietary guidelines led by Ethiopian Public Health Institute. These were to be ready in 2020, but it was not possible because of the COVID-19. However, what has happened is that the food-based dietary guidelines have recognized the fact that availability of a more nutrient food basket is a challenge. And therefore, these food dietary guidelines actually have a secondary objective that targets food systems actors to ensure that there are actions that are taken to diversify and make a more nutrient food basket more affordable to more people. And so when we speak about food systems transformation, we need to think in terms of what can we do to be catalytic to a positive food system transformation? Which are the areas in the country where attention is needed? In terms of food processing industry, I said this is in infancy and we need to learn lessons from elsewhere and make sure that as we start building those agro-processing industries in the industrial parks, that we actually start them with good practices for nutrition and health. And then we also need to be mindful of the fact that as we transform and begin to process more to increase shelf life and what have you, we need to make sure that our processing does not then fully just depend on putting more fat, more sugar, more preservatives. What are the new things that are coming up that would allow us to do better for these types of processing areas to ensure that nutrition and health are served positively? And I say this referring again to what Dr. Alab showed us, the fact that as it is, Ethiopians are already consuming over the recommended level of salt, for example, based on WHO recommendations. So as our food processing industry begins to develop, we should already be putting in place standards and guidelines that ensure that we do not tip that balance even further than it already is. And then there's the issue of trade. What role can trade actually play in this transformation process that we are talking about? What type of policy instruments are in place? And when we think about trade, we will have to position this within the broader African context with the African Continental Free Trade Agreement that has now come with us. And so our deliberations around food systems transformation need to look at what are the trade issues that need to come on board in terms of standards to ensure that those are done with a nutrition lens, but also with sustainability in sight. And so currently, there are multiple discussions that are taking place in Ethiopia aimed at informing an Ethiopian position towards the UN Food Systems Summit. There's a roadmap that is being developed. There are food systems dialogues that are being planned. There are all sorts of other stakeholders that are trying to do something. It is important to ensure that whatever the country comes up with is informed by the challenges that are now being faced, learning lessons from elsewhere, to make sure that what is put forward as the desired food system transformation for Ethiopia is actually one that serves nutrition and health, while at the same time also allows developments that do not degrade the land, water, and the soil, to make sure that sustainability is an important aspect of the transformation that is taking place. And thank you very much.
Thank you very much for your reflection, Dr. Namo. We have very few minutes left for question and answer session. So I'm gonna go and pick the first three questions and forward it to the speakers. The first question is to Eileen. It's from Lisa. It says, are unhealthy foods considered or addressed in the healthy food system? If so, how?
Yeah.
And
Oh, sorry. Go ahead, Rahel. Sorry.
Okay, and
Please.
I'm
Sorry.
going to forward the second question, Dr. Alab. It's from Mesfin. He says, is it a question of priority or poverty? Can we even think of dietary diversity without achieving food security? And I think the second question can also relate to that. WHO says 5 servings of fruits and vegetables in a day. Is it achievable even in a developed countries like US and Western Europe? I think those are the questions we have so far. If we give, I don't see any questions for Dr. Namo yet, but I'll be forwarding those as I get them. Okay, please go ahead, Eileen.
Thank you, Rahel. Yes, all types of foods are involved in transformation of the food system, healthy and unhealthy foods. I believe sometimes there's the impression that processed foods across the board are unhealthy. This need not be true. And I want to build on a comment that Dr. Namo said, which is the food industry, food processing industry in Ethiopia is in its infant stages. And I think there are enormous opportunities to look at how to make healthful foods more nutritious. I mean, the example of decreasing salt in processed foods, but also make them more affordable. And I think there are ways of doing this. In Rwanda, for example, there's a joint partnership between the government of Rwanda, a World Food Program, and private sector, where they've built a factory aimed at nutritious complementary feeding at a price that's affordable for the population. And there's a tiered pricing where a very low price is charged to WFP to provide foods in more of an emergency or safety net session, and it goes up from there. So that's one opportunity. The other is to think about the private sector responds to consumer demand. So how do we in the food environment create consumer demand for healthier foods is another aspect. And I think undervalued at this point is how do we use fortification policy as a way of taking processed foods and improving the nutritional quality. But let me say a key part of that is not simply availability, but as we've seen from the presentations, accessibility. And what I failed to mention is that rural poverty, again, a success story in Ethiopia, rural poverty has been decreasing.
Okay, may I?
Thank you, Eileen. Thank you, Eileen. Khalid, please go ahead.
Okay, thank you. Thank you, Musfin, for the nice set of questions. First one is priority is poverty reduction, and perhaps food security comes first before dietary diversity. I personally think that we shouldn't decouple them. It can happen at a time, and that's the reason I gave. That's why I gave the example of the fruit and vegetable sector. Looking at that, we were looking at its impact on income, job creation, nutrition, and so there is possibility to achieve multiple goals while diversifying your diet and diversifying your production, because you're now producing more value-added products like fruits and vegetables that are sold at a premium price or at a higher price. And so there is possibility to make a win-win out of that. And so it shouldn't be first tackling poverty, then the other comes. There's a possibility to address multiple goals at a time. And I do understand that the 5 servings of fruits and vegetables per day that WHO recommends is looking at the Ethiopian figures. It's very far, but even if you look at the more recent estimates from the pure cohort that recommended at least 3 servings per day, even considering that lower number, we're very far from achieving it. So, and this is again in line with our production system. Not enough supply of fruits and vegetables, and so not affordable. And so the transformation is not just from behavioral change perspective, but the transformations that are needed should be reflected as well on the production side, on the market linkages so that you reduce post-harvest loss, and also shortening the market, the value chain, so that you don't have unnecessary price increases before it ends the consumer. So yeah, it would require multi-sectoral intervention. I think that that will answer, I hope, Muslim's question. But then maybe if I take the liberty to answer Gina's question on what can we do then if access to nutrition education is not optimal yet, and what could be done because of the high burnout of the health extension workers. I think we really need to sit down and think. The health extension program has done a marvelous job over the last decade, but it's now time to think, because we've added so many activities, and it's becoming very difficult to make effective nutrition education, nutrition messaging. Perhaps using multiple platforms, as illustrated by Alab and Tribe in their activities in Ethiopia, but also using respected members of the population, community leaders, religious leaders, engaging them in the process, and making the nutrition messaging natural and connected to the society and to the lived reality of the population. I can say consume 5 servings of fruit and vegetables as recommended by WHO. That could be one form of messaging. But I think in the Ethiopian case, we need to go at step up at a higher level and think of how that could be possible, not just what, but how that could be made possible. Yeah, but we need some innovations in this aspect. Thank you. Over to you, Rahel.
Rahel, can I just add one thing, because we are going to have a future webinar on behavior change, and I'm building on what Dr. Kalibas just said. In one of the activities under Growth and Nutrition, something called a virtual facilitator, which I call Nutrition Education Plus, we found a whole household approach involving not just the women mother, but the husbands in the household to be very effective. And I think we need to look at different strategies. What is the message and who are we targeting? So we'll be discussing that much more in the future.
Thank you, Eileen. I'm going to forward two last questions. That's for Eileen. Can you elaborate on the trade-off between farmers' income, risk, and willingness to diversify production? What are the successful strategies to shift agriculture production toward diversification when that has not at all been the policy directions to date?
Yeah, and Rahel, thank you. I like to emphasize success stories. And one of the ones that immediately comes to mind, because again, Growth to Nutrition has also emphasized production of bio-fortified crops. And when this first emerged in Harvest Plus out of IFPRI, one of the key components was they had to ensure for farmers with the adoption of these high nutrient dense crops like orange flesh sweet potatoes, they had to guarantee for the household that yield would at least stay the same or maybe go up, but it wouldn't decrease. And I think it's important that we're talking about behavior change, that behavior change typically is nested in much larger strategies. And the orange flesh sweet potatoes was a adoption of the crop. It was nutrition education targeting consumption of these crops by preschoolers. It was generation of income for women. So it was a total package. And sometimes we have to think about, when does freestanding behavior change work versus when do we have to nest it in a larger package of services? And I think that's very important in the context of Ethiopia.
Thank you so much, Eileen. Now we are at the end of our webinar. We have a number of questions from the participants, but because of the limitation of our time, we might not be able to go over unless the presenters are willing to go over and address some of the questions.
I mean, it's fine with me, Rahel, if we're not going to be cut off.
Okay. No, we're not. Okay, then I'll forward another questions from Victor. He says, regarding project activities such as growth through nutrition, should the focus continue on diversifying homestead food production and or diversifying the food supply, such as investing in nutrient-dense value chains, as Dr. Alab has suggested. Might a project consider doing both approaches? And if so, what might be the trade-offs? This is the question to Eileen.
Oh, to me, okay, sure. I mean, I think we can look at this in several different ways. Sometimes the assumption is that by production on farm of nutrient-rich foods, nutrient-dense foods, consumption will improve, maybe or may not. Another strategy would be, how do we increase household income? And Dr. Alab was very clear in his chart that as household income improves, dietary diversity improves. So I think a joint strategy of increasing household income, and we didn't emphasize this as much, but as the population is becoming more urbanized around the world, including in Ethiopia, we have to think about strategies for the urban population of increasing income. Foods have to be available. That's a strategy, increasing income, increasing dietary diversity. But let me say, we also have to address the taste preferences of households. It's not simply enough to have the foods available and accessible. People have to want those foods.
Okay, thank you so much, Eileen. I'm going to forward this. This is the question that we've received from participants during the time of registration. Possibly Dr. Namuko could address this. What effect has COVID-19 on food systems, and how prepared is the world to address the growing inequalities in our food system? This is from Hafiz, Oxfam in Ghana.
Wow. Well, COVID-19 has disrupted food value chains, markets, but I think the surprise has been the fact that the value chains have actually been a bit more resilient than we expected, especially at the global level. Because initially some countries were closing borders and stopping food from moving. However, I think what we need to recognize is the fact that food systems have been affected differently in different parts of the world, depending on when the pandemic actually took place against the growing season. For example, if I use Ethiopia again as an example, when the pandemic started in February, March, Ethiopia was just coming out of a harvest season when it was becoming worse. So the household would have had their harvest. But as the pandemic has continued, we now don't know what is going to happen, because we know that inputs for agriculture have been affected to some extent. So what effect will that have on this coming harvest? That we yet have to see what those effects are. So I think it is important to keep that in mind. On the African continent, one of the things that happened that seems to have been useful is that in April, in the middle of the pandemic, the agriculture ministers of African Union member states met. And the idea was to facilitate movement of food across borders. And then in addition to that, the regional economic community, like the East African community, they also put in place COVID response plans, which were aimed at facilitating movement across borders. So those helped. But I think the lessons that we can learn from there is that we need to have instruments in place preempting the next pandemic, so that we do not run. We've had a trial and error situation now where people closed borders and then opened them. And I mean closed borders not to people, but to produce, trying to close the markets. So those lessons, I think we need to carry them through to the next pandemic. Hopefully it won't come soon, but we need to be ready, I think, with policy instruments that we could draw upon in such situations. Thank you. Over.
Thank you so much, Dr. Namakolo. I have also one more question for you. With so many competing nutrition needs and variables, what nutrition priority must be tackled first to see progress in SDGs? This is from Amy Aber, USDA.
I don't think we necessarily can say we are going to prioritize this over something else. We have currently prioritized mothers and children in both at the global level and national level, which is important. But I think as we do that, we need to be mindful of the rest of the population. So the targeting at the moment is for mothers and young children, the first 1,000 days. And the reason is because this is where undernutrition has the biggest negative impact that has a ripple effect even in adulthood of those people. So it's critical to be able to address that. Where I think we should be careful is not, for example, for African countries to focus only on undernutrition and not worry about overweight and obesity, because what that does is it sets us up for very difficult times in future. As it is, we know that all of the 54 African Union member states are on an upward trajectory for overweight and obesity, and then the non-communicable diseases come on board. So we already have these cost of hunger studies that have been done that have shown that there's a very high cost to undernutrition. For Ethiopia, it was 16.5% of GDP, even though it was done, that study was done in 2009. The implication is simply that undernutrition is costly. We cannot afford to add on top of that additional costs now coming from the negative impact of overweight, obesity, and non-communicable diseases on health systems that are already weak. And therefore, we cannot ignore that. And that's why there has been a shift towards talking about all forms of malnutrition being addressed. And some of the interventions can actually be double duty interventions that can address both. Thank you.
Thank you, Dr. Namo. I have one question for Eileen. How can agroecology and food sovereignty and health be prioritized in food systems? This is Elizabeth Westaway, an independent consultant.
Great question. Again, there are a number of activities recently around agroecology. There's a very fine report from the high-level panel on agroecology, and institutions like FAO has emphasized agroecology as one in a menu of sustainable agricultural strategies that could be very effective. I see agroecology and food sovereignty very closely linked because they emphasize the individual community level. Agroecology emphasizes traditional knowledge, which we know has worked. And so from a respecting natural resources, it can be very effective. Food sovereignty, again, providing representation and power to local level people who have the knowledge. The challenge, and it is a challenge, is we need to think about using the positive and the essence of agroecology. How do we scale that up? And I don't think we've identified that totally. And I know countries want to use it, but how do we scale it up to a larger area of countries? And then the second part is private sector investment seems to be essential going forward in agriculture. How do we get sincere private sector involvement in agroecological approaches so that the scaling up is possible? But I see enormous potential there that has been untapped.
Thank you, Eileen. Thank you, Eileen, for that. I have a question for Dr. Alab. The decline in diversity does not correspond to the basic economics fact that is the price goes up, production goes up. How the production of cereals increase when the price goes down and goes down for the other food groups?
Okay, I'm not an economist, but I'll try. My impression is that it's a supply and demand balance issue. So the more cereal production that you have, the likely that it would stand general inflation, and so you wouldn't see an increase in price. But for sectors that where we have very limited production, such as fruits and vegetables, then the price increases are related probably to an increased demand in urban areas. But yeah, that would be my take. But yeah, you would probably need an economist to figure out the exact reason.
Thank you, Dr. Alab. There is also a related question. Why the diversity of production decreased between 2011 and 2016 in Ethiopia?
Yeah, so we have an increase. Yes, we've witnessed an increase in production, but it came from one category, which is the cereal, root, and tubers side. So if you're looking at out of the total, it's taking a larger proportion, pushing but pushing others, and we can say also that there is a very bold prioritization towards production of cereals. So that has been the policy for the last decade or so in many African countries, including Ethiopia, and so. You have more land being attributed for production. Whatever input you have is being put for production. Whatever incentives, etc., are being put for cereal production and not for the other food groups. So that could probably explain why we're seeing a decline in the share of the other food groups.
Thank you so much, Dr. Alab. I think most of the questions have already been responded. Some of them already responded through the chat online. So thank you so much, all the speakers, for your great, insightful discussions and presentations, and all the participants for your time and for your active participation. As I mentioned earlier, we'll be sharing all webinar materials in the coming few days. This includes the link to this video, the PowerPoint presentation, as well as the summary report and some supplemental reading materials to all registered participants. We thank you again for all your active participation. And so we'll be looking forward to your participation on our upcoming event, which is planned in February. We'll be sharing detailed information in the coming few weeks. Thank you so much again, and I hope you enjoyed the webinar and it has helped you to shape some of your understanding around the transforming food system and how it's important in improving food diet and also in addressing some of the SDGs. Thank you so much again. We will look forward to your participation in our future webinar. Thank you.
Thank you. Thank you.
Thank you.